infrastructure, health facility. It's an ongoing process to be able to meet the demand of the public. As we know, the Commerce District is served only by 10 clinics, 2 health centers, and 1 hospital, that is Katutura Intermediate Hospital. Windhoek Central Hospital is a national referral hospital, but the district of Windhoek is served primarily by the Katutura Intermediate Hospital. There is no district hospital in the Commerce region. Unlike in many other regions, we have district hospitals. Now, in the absence of a district hospital, now Katutura Intermediate Hospital is serving both as a Class C district hospital and Class B intermediate referral hospital, so all in one. Mm-hmm. Now, there is now congestion and also the scramble for services. The population has increased, the disease burden has increased, the disease profile has also changed, and therefore, in order to decongest Katutura Intermediate Hospital, we need to construct a district hospital for the Windhoek district. Mm-hmm. And this is now the Windhoek District Hospital, which the Minister of Health or the government is going to construct, mm-hmm. which is a 250-bed hospital. Mm-hmm. This will now take off the pressure from Katutura Intermediate Hospital. It will result in improvement of the quality of service at Katutura Hospital and both at the district hospital. Mm-hmm. And Katutura Hospital will then focus more on its original mandate. That is to improve the quality of service as a referral hospital, and also for the training of health professionals, be it medical intern, pharmacist intern, dental intern, physiotherapy intern, occupational therapy intern. Mm-hmm. So the movement of more patients to the district hospital will free up space for the Katutura Intermediate Hospital to execute its original mandate. Mm-hmm, mm-hmm.
So what will the functions then be, Dr. Shangula, mainly of the Windhoek District Hospital?
Well, that will be the second. You know what we have, the structure we have in the health system is that you have the clinics, or before the clinic you can also have health posts. But we do have the clinic as the basic unit, mm-hmm. for service delivery, and then you get health centers, and then you get a district hospital. Now the district hospital will be able to do all the basic services, that is obs and gyn, surgery, anesthesia, internal medicine, obs and gyn, mm-hmm. you know, all the basics, mm-hmm. they will be done there. And that hospital will also have specialists in the main domain. Mm-hmm. And then only when there are complicated cases, then they will be referred to Katutura Intermediate Hospital for advanced specialist, you know, services.
Mm-hmm. You mentioned how the Windhoek District Hospital is envisaged to release the pressure that the Katutura State Hospital is currently experienced. Is it going to act in the same, you know, in the same way for the Windhoek Central Hospital?
Yeah, no, the Windhoek Central Hospital is in a different category altogether, because that's a national referral hospital. Mm-hmm. Even Katutura Hospital would then refer to Windhoek Central Hospital, but Windhoek Central Hospital will get from all over, from Shakati, from Rundu, from the coast. So it receives all the complicated cases for advanced specialist management. Yeah.
250 beds, of course, is no small feat. So when was construction meant to commence, and of course, what location in Windhoek has been identified for it?
Yeah, we have identified a site that Farm 508, that is in the Havana area. That's where the hospital is going to be situated, close to Havana High School. The access road is this, the one which is under Ongos village training. Yeah, so the construction per se will really depend on the completion of the feasibility study. For example, now the consultant has been appointed to do the feasibility study. After the feasibility study, then all the documentation will go on, and then of course the invitation to people who are going to construct, and then the construction will start. We expect the construction to start as soon as possible. Yeah.
And Cabinet has directed the Ministry to mobilize funding for this construction. And how much, will this cost government, more or less, in terms of figures, and what are the plans on getting these funds together?
Well, the funding will not come at a go, because the hospital, the building of the hospital goes according to different phases. There is the feasibility study with its own costs, and then you'll have the actual construction, and then you have the purchases of the equipment, and all those things. Yeah. So, and also it will also depend on the escalation. The faster we construct, the less the expense, because the longer we take, the more expensive because of the escalation.
And you mentioned equipping the hospital, obviously, which is going to be another big task to undertake. And of course, we know that the current hospitals that we do have, sometimes, they're not fully equipped. So what are the Ministry's plans in not only equipping the new Windhoek District Hospital, but all the hospitals within the city?
Well, the necessary equipment will be part of the construction project. It will be part of the project. So that will be included in the construction phase. With the medical equipment, one thing is that the technology evolved too fast, and then of course you must always keep up with the new technology. So we will try to acquire the best technology for the new hospital. At the same time, I must also mention that we are also engaged in the improving of the existing health infrastructure, whether it is hospitals or clinics, in terms of improving on the physical infrastructure, the medical equipment, and also to ensure that there is sufficient human resource to be able to do the work.
Fantastic. Yeah. Well, Dr. Shangula, that's all the time we have this evening, but thank you so much for your time, and thank you for joining us.
Thank you very much. We are looking forward for this new development.
Indeed so.
Thank you.
That was the Health Minister, Dr. Kalumbi Shangula, joining us there. We'll be right back after the short break. Stay with us.